Okay, so let's get started. Welcome everybody to a smart salon, testing the limits. We're going to be focusing on the topic of designing the next wave of diagnostics. Before we get started, just wanted to quickly introduce Smart Design. We're a strategic design company based in Brooklyn, New York, and really focused on improving people's everyday lives through design and helping ambitious companies achieve kind of growth by doing that. This event is part of our ongoing series that we've been running since 2010, so actually quite a long time, and really bringing together different business, design, and technology leaders to discuss topics which are both important and timely in the world of design and innovation. And just on the right of the slide, there's a few of the kind of topics that we've covered recently over the last year, just to give you a sense of some of the other things that we cover in these events. We've been focused on design research topics, sustainability, the impact of technology on society more kind of broadly, and looking at the topic of personalization. So lots of interesting topics, and I'll talk about the Salon that's to come at the end of this event so that you can get a sense of what's coming next as well. Just to introduce myself, I'm Richard Whitehall. I'm an executive director and partner at Smart Design, and I'm co-hosting with Mary Warren, who's a senior program manager who focuses on a lot of our work in the healthcare space. Both of us have been involved in really a whole series of interesting healthcare programs over the last few years, and a lot of them have been touching on this sort of topic of low-cost diagnostics and testing, which is one of the reasons why we're really honored to have this panel and to dig into the topic a little bit further. So some of the reasons why this is a timely and interesting topic, partly we've kind of seen increased cost of low-cost diagnostics across both the health and wellness sectors, rolling out over the last few kind of years, but especially during COVID and the kind of acceleration of, low-cost testing for COVID tests, but I think more kind of broadly use of kind of telehealth and things that are reliant on different low-cost diagnostics to provide data. This kind of acceleration seems to be happening more kind of broadly. And we're seeing some of these diagnostics being used at kind of home and in people's lives, and then kind of other things which are more focused on optimizing treatment within healthcare settings as well. So I think some of the questions we kind of really want to tackle today are really what are some of the transformative impacts of low-cost diagnostics, and what are the broader implications across the healthcare system. And then how can we as designers and people involved in design better meet the needs of different people who are involved and affected by this kind of broad change across healthcare. So this is the topic. I'm really honored to be joined by Arthur, Carlos, and Elias, and we have a few slides next, and I'll get each of them just to introduce themselves and just kind of talk about one aspect of their work that relates to this topic. So I will start with handing it over to Elias.
All right, thank you, Richard, and hello, everyone. So my name is Elias Erjan. I'm the CEO of Business Brain, which is a consulting firm that focuses on the health, wellness, and sort of biotech sector. Former senior vice president of BioStrap, which is where I've taken my image here from, because for those of you not familiar with BioStrap, I'm sure a lot of you are familiar with wearable technology. And one of the things I spent a lot of my time at BioStrap doing was educating everyone from even people who were physicians or in the medical space. If you're not specifically in the wearable space, we know that we have this sensor technology. People are wearing it on their wrists or various parts of their bodies, but they don't realize, for example, in this image, the difference between the sensor using green light photoplethysmography versus red light photoplethysmography. And so I know that's a big fancy word, but PPG sensing. And there's a big difference between the red light is more like medical grade, sort of clinical data acquisition, but the vast majority in the wearables are green light sensors. So when Richard asked me to sort of do a little bit of information about some of my work, I just thought this would be a great way to illustrate how just because the device is on the wrist doesn't necessarily mean you know how it's collecting the data, the quality of the data, how to interpret the data. So there's a lot of pieces here that are coming up in wearable technology, diagnostics, and I'm honored to be part of the panel with some very illustrious peers of mine to discuss this with you today.
Thank you so much, Elias. We'll go to Carlos next.
All right, hello everybody. I'm Carlos Gutierrez. So I'm actually reading it because I forgot for a quick moment who I am. But I'm Director of Design and UX at Johnson & Johnson Design. So there's basically a studio within the much larger company of Johnson & Johnson. And so basically I lead up design for one of the largest portfolios of work. So it's everything really under pharma, supply chain, and medical devices. So you can imagine it's quite a bit of a lift. So I'm really excited. I geek out on my team, who's really just incredible. So a lot of the work, really a lot of the discussion, I really got to give them a lot of credit for what we've been up to. So the picture over here to the right is actually an intestinal worm. Not that that's a fun topic to talk about, but one of the things that my team's really focused on right now is really thinking about, well, in this kind of low cost diagnostics conversation, but one of the things that they're really looking at is what do we do in these sort of like resource limited areas for diseases, for example, that are preventable, right? So for example, with intestinal worms, imagine a kind of a mobile field team basically goes to an area, takes samples, finds out that in this particular area, there's quite a bit of folks who are coming up, or rather who have intestinal worms. So think about how do we mobilize quickly? How do we identify these things before they continue to spread, but for preventable disease? So super excited, same, and I echo Elias's comment on the panel. So very excited to be here.
Thank you so much, Carlos. And then next, Arthur, if you could give us a quick intro, that'd be fantastic. I'll just get the slide moving in a second.
Okay, great. I'm Arthur Henderson, president of Affinity Networks. We are at sort of a different perspective from the other two folks on these, my other two esteemed colleagues on the panel. We really focus on patient populations and delivering, empowering consumers to do more with the information they're presented. We really focus on underserved patient populations. We've done a lot of stuff with the VA, we've done a lot of stuff with the disabled, we've done a lot of stuff with traditionally underserved. And we're trying to find ways to take all that data, whether it's coming from a test or wearable, and give the consumer actionable intelligence from that, things they can do to actually affect their daily lives. So our perspective, I think that the three perspectives are great because we really focus on that consumer side and using technology to what we say enhance human flourishing.
That's great. Thank you. That's a great kind of intro, Arthur. And yeah, I think that the three different perspectives are really fascinating on this topic. So looking forward to digging into the conversation. Before we get started with some of the questions from our end, I just wanted to let the audience know that there is a Q&A box at the bottom of your screen. And I think as we're going through, as you think about different questions, whether it's for an individual person on the panel or for the panel in general, please add questions into that box. And we've saved a little bit of time at the end of the agenda to run through some of those questions with the panel. So please keep them coming in there. And again, if there's things that you want to chat about with the audience or with the panelists, feel free to put those in the chat box, and everybody should be able to see those. Just also wanted to remind everybody that the session is being recorded, and we're going to post a quick summary of the discussion up on our website tomorrow, and we'll send out an email so that you guys all kind of have a summary of all the stuff that we spoke about today. So I'm going to stop sharing my screen, and I'm going to hand it over to Mary, who's going to start out with some of the questions for the panel.
Yep. Thanks, Richard. So we're going to start our first set of questions are going to be sort of an overview of the space as a whole. And so the first question we would love to hear from each of your perspectives on, but Carlos, I'm going to toss it to you first. So when thinking about the potential of low-cost diagnostics to transform the healthcare space as a whole, what are you most excited to see maybe over like the next 3 to 5 years?
I mean, for me, it's definitely the democratization, right? So the fact that everybody can potentially access this, I think it's the best way to go. I mean, this is like one of those quick trips to an office that you then wait for something afterwards. And I feel like bringing that up forward into the funnel, I think is a great way to go. When I look ahead, I like to see, or what I get excited about, are just how certain technologies are sort of being applied in the overall sort of to enhance the user's experience, so to speak, right? So, artificial intelligence, machine learning, even virtual reality, right? So just really thinking about what is that next step. I think the biggest area for me is really service design. What is the extension? How do we support beyond just the during, which is getting that diagnostic? Once you have that, then what happens? So really thinking about the proliferation of that and how do we support people through that.
Awesome. Yeah. Elias, what are your thoughts? What's your perspective here?
I guess there's two pieces of this that I'm really actually quite excited about. One is, I think, obviously on the technology side itself. I mean, right now, a lot of us, I said, are using wearables, even, our smartwatches. But now we're moving to some pretty advanced technology. There's something coming out with something called molecular sensing. So for example, like if you use a continuous glucose monitor today, right, it's moderately invasive. You got an intracellular nodule that has to pierce the skin to get that information in the CGM. And this molecular sensing technology would be like our current wearables that you just wear on your wrist, let's say. But they were able to do things like actually know the concentration of certain elements in our blood. So almost be able to do blood work, and actually be able to collect that at home. So there's a lot of people working on this. I think a lot of companies are getting purchased as soon as they file a patent. All of a sudden, like Apple or one of the big players is purchasing them. So there's a lot of interesting things happening there. But there's one piece that I think I don't hear a lot of people talking about. And that's the fact that I'm not going to completely bet on AI here. I think there's going to be a new human industry where there's going to be intermediaries between the physicians and the consumers, where we're going to need like a new category of kind of like health coach or potential team that will be supporting the medical industry to serve. Because if all of these people now can do self-diagnostic at home, how do we impact the behavior? How do we enact behavioral change? And so, coming back to the CGM example real quickly, for example, there's some companies that are doing continuous glucose monitoring through AI technology through the app. And then there's another large company that's doing with registered dietitians and nutritionists, and then they're providing human coaching. And so I'm kind of hopeful that we're going to actually see a whole new class of healthcare providers that are going to be in an intermediary space that are going to start working on prevention and ongoing sort of behavioral change to get a healthier population, because right now we're not doing so great there.
Yeah, absolutely. And Arthur, what are your thoughts?
I think while the wearable and the testing provides 5 to 10% of the clinical data, the other exogenous data, 98% of healthcare happens outside the doctor's office. So we're creating, I'm seeing trends where we're actually developing ambient sensors to be able to observe and obtain information on the consumer as they are in that other 98% of the world. And so I see a lot of things on low cost, low power, self-powered wearables going on that excites me. I also agree with Elias that, I'm heavily involved in some stem cell projects and things of that nature. And we understand the impact that's going to have on workforce. If we can't manufacture aspirin in the US, how are we going to manufacture a unique aspirin for every individual? So there's a huge workforce component that it piggybacks exactly what Elias was talking about. Not only will it be needed to support individuals on the interpretation of clinical data, but also just to do the wet work, the wet lab work that's required for some of the things. as well as the analysis. So those are the two areas that really, I think, are future facing.
Yep. As a follow-up to that, you touched on this a little bit, but what do you think are some of the key capabilities that a company is going to need to be successful in this space? I know you touched on a few there.
Well, it's going to have to, we have a concept we call inclusive innovation, where we have to eliminate some of the other biases that are inherent in innovation. You know, typically you think a university, they can't produce production content, and it's going to be slow, but they do great research. Universities look at small businesses, oh, they don't know what they're talking about. So part of what we need to do is really break down those silos and come up with these multidisciplinary teams. You know, the conversations I've had with you guys and with Elias and with Carlos, just because we have different perspectives and we're open, that has led me to some other great assumptions. I've learned a lot already. So that's the number one thing is the leaders of these new companies have to have that inclusive perspective on how they innovate and how they develop things.
Yep. And Carlos, what are your thoughts there? Like key capabilities for a company to be successful, and any key players you see in the space doing it today?
You know what? I think one of the conversations I'm having right now, partly with myself, but also with my leadership, is actually around talent. And I actually think we're going to be going back the other way. So I know STEM is the big thing right now, but I honestly think we're going to go back to the humanities. I feel like, in kind of building off of where Elias and Arthur were talking about with the services and the people, I think there's just empathy needs to be there. And I think as you start taking that up, you know, and someone does the diagnostic, how do you then help somebody move through that? So I feel like that is going to be huge. How to have a conversation, how to move through and really understand what someone's going through, or even having somebody ahead of you who might have gone through it, right? So how do you then start partnering people to people again, right? As opposed to machine to machine. So you send your diagnostic, it's in your file, right? So I literally think it's the sort of people component.
Yep. That's actually a really, really great transition into our next section of questions, which is all around consumer benefits and design challenges. So thinking about the consumer, you brought up, you know, empathy, just having conversations. So Carlos, what do you think are some of the biggest benefits to low-cost diagnostics to consumers themselves?
I mean, to me, it's just knowing, right? So I think the urge right now is like, what do I have? I just need a name. I think that's sort of like the big need. So the fact that you get that quickly, you can understand it. What's the first thing most people do is they start looking it up. I have a name. There's something about just having a diagnosis that seems to calm people, regardless of what it is. So to me, that's going to be the biggest value. I think also the challenge on that is going to be privacy and transparency, right? So you're getting this information. I can now learn quicker and sooner and faster, but now what do I do, right? What's happening to my data? Where's that going? So I feel like it's a sort of a tension that exists there.
Yep, absolutely. Elias, any thoughts there as well?
Could you just repeat the question again?
Yeah. So what are you seeing as some of the biggest benefits to consumers themselves, and how do we keep them engaged and provide value?
Well, this is why I think people need to be involved. I think to Carlos's point earlier about empathy, I see these companies, as I said before, you know, trying different approaches. And I'm not betting that AI through an app is going to change human behavior. Because if you really think about what we need is we don't just need more data. So we can have better testing and we can provide this data, whether it's to the clinician or to the actual individual patient. It almost is, it doesn't matter, because what we actually need to get in the business of is behavioral change. Because if we have 60% of the population, you know, obese, we have, you know, extremely high numbers with, you know, some form of chronic condition around the US, and that's growing now around the world. You know, we need to start getting the business of prevention. And I don't think we're going to do that through an app by itself, although there's a lot of well-meaning apps out there. So please don't take offense at that. But I honestly think that, you know, I've been seeing this on the front lines with a number of different providers. And I'm seeing that, for example, there's one company we worked with where they literally just have a nurse that just calls you and checks in with you for 15 minutes. And the impact of that was so much, because if you have a notification pops up on your phone, you're supposed to do your blood pressure cuff today, you'll just scroll that away. But if this very friendly nurse calls you and asks you, hey, did you do your blood pressure today? We really want to check how you are. Then the person, oh, I'm so sorry. I should have, I meant to do that for you. And now it's a person, to Carlos's point, it's an empathetic human to human interaction where now you want to make sure that that person is there because they want to care for you. You're going to have a totally different outcome. And I think that's so there's a great benefit if we can start creating a new ecosystem of people, talent that are able to act in that intermediary space in healthcare, which right now doesn't exist. So it's a big ask, but I mean, that'd be the dream, I think.
Hey, Mary, real quick, can I just add something to that? Like on your point on AI, it's funny because it's the framing of how to use AI. I think a lot of people betted quickly, like this is going to change everything. And it's like, yeah, but for what purpose, right? Are you going to automate the whole process, right? As opposed to assisting someone to help them with something to then, kind of come down the line from that. But.
Right. So AI empowers humans to be better, not replacing humans.
Exactly.
And I agree with you. I think that's what it has. We have to reframe this whole conversation around that.
I think it's important to, while we say AI, to really talk about digital transformation versus AI, because what's embedded in AI is traditionally the human looks at data, comes up with the assumptions, codifies that, and they implement an algorithm. The difference with AI or machine learning and convolutional neural networks is the processor can look at more permutations than human ever can, and can do it quicker. And then it codifies, the algorithm codifies that process, and the danger is it's not explainable. So that's where we have a separation is where we need explainable AI, because once I cross that divide, now I can have the computer, I hate to say this, but simulate empathy and make the delivery of that empathetic experience more scalable and replicatable. So the level of machine learning now is just more transactional, but where we're going with natural language processing and other things like that is we'll be able to duplicate some of that empathy that we're describing right now.
I know that we're supposed to hold questions from the audience until the end, but we had an interesting question come in that I think is relevant to the topic that we're on. But Brendan had a question around just saying that designers and engineers and things like that often look to fiction for inspiration for like what the future could look like, specifically around AI, all these different things. There's a lot coming out in Hollywood that depicts the consumer's experience around all these different technologies. So where do some of you look for inspiration about what a better, more exciting future might look like for consumers? So I'll kick it back to Arthur to start.
Wow. I try to just keep it really simple. We did some major projects with the Veterans Administration, and they were trying to figure out, let's bring in designers to come up with the best way to show a patient where their lipid panel exists. And our experience has been, well, the consumer wants to know three things. When's my next appointment? What are my meds? And what do I need to do today to not die? And to be the best way to present that information in a very quick, easy, comprehensible method is what we believe the consumer really wants to see. Now integrate that in with some of the other things, the social determinants of health, some of the other components in my life, whether it's finance, nutrition, housing, entertainment, job, deliver health content in the framework of all of those other things that from which I garner other value. And that makes it more persuasive and more interesting to the individual.
Yep. Elias, any thoughts to add there?
I'm really digging hard on this one in my mind because I'm a sci-fi buff. So I'm really thinking like, okay, what would, and there's probably a lot, if I had more time to think about this, I probably could do a whole dissertation on it. But I think I'm going to pick two on the spot here. One, I guess because of my interest in wearables, I'm going to go classic and talk about Star Trek, the idea of like a tricorder, the type of thing like you could scan an individual and just literally, again, like coming back to that biosensing technology I mentioned earlier, the idea you could scan an individual with a device and actually be able to ingest some data around their health. I think that would be a sort of a dream of a lot of clinicians around the world right now. And then the other one, because I'm very active in the space of biohacking, and there's this real, I don't know if anybody remembers the movie, it's not the biggest sci-fi movie, but the idea of a limitless pill, essentially a pill that would, or some type of something that would like unlock human potential. And so I do know, and I actually work with some companies that have gotten to the level of cellular medicine where they're starting to unlock the potential of longevity compounds, looking at what creates cellular aging and actually potentially being able to extend the lifespan or health span, maybe not lifespan, but health span of cells. And potentially, with the space of things like nootropics and, precision medicine, there's this idea that we could actually unlock the capacity of the human mind to remain essentially highly functional much later in life. So that science fiction actually is, in my sense, actually already becoming science fact right now. And there are people today who are, maybe they're doing it for, to get on the media, but they're claiming that they're going to live to 150 years old or 200 years old. And for those of you who follow like Ray Kurzweil talks about the singularity. And he says, if anybody who can live till 2030, that by 2030, we are going to have cellular medicine that will extend lifespan potentially significantly. So that is something that is sincerely talked about in certain circles today.
Yeah, absolutely. Go ahead, Carlos.
Yeah, I mean, for me, and I'm looking at this from from directing teams of kind of multidisciplinary teams, sort of in a design context. I think everything's on the table, in the sense that I think some of the best inspirations come from like a joke, where all of a sudden it was like, wait, what did you say? What was in there? And sometimes there's that kernel in there, and sometimes it's just tapping into just being a kid, hence why I got a video game background, right? So it's just, where does that inspiration sort of come from? And I think it's all on the table. Now, I think the key though is figuring out, like, for example, there was something I was working on, a pretty large company on their wearable, trying to figure out what is going to be their digital experience and how does it live. And literally the joke came up, well, we need to go back to the future. And that literally became the framing for the whole thing of how the experience sort of unfolds. You can go back in time to see what you did, which then influences the future, right? That could have been one of those throwaway comments, but that literally became the frame for everything. So to me, I think it's wherever it comes in. I think the key is how do you just kind of sculpt fog out of that and sort of not be literal with some of those things and sort of evolve it. Now, as far as being afraid of it, listen, I think we all should all be afraid of how quickly things are moving, but you hope that there's really good people on the other end that say, wait a minute, we're going to sort of like pull this back a little bit to kind of keep the rails here. So it's not, the robots aren't coming for us, so to speak, right? But I think it's just a constraint we have to sort of accept.
Yeah.
Great. I'm going to pick up a few kind of themes, but before we do that, I just wanted to kind of pull out one thing that I was hearing in the panel, which was, low cost diagnostics have the potential to kind of scale technology, data combined with AI. We can kind of look across the like population a lot more kind of broadly, but it seems like the kind of real unlock is the human component and how you bring that like humanity, whether that's using VR or something else to kind of do that. And I was wondering just like how do you scale that human part of it, right? Because there are a certain number of employees within the healthcare system currently, they're already really stretched. So like, how does that kind of play out? And what's the role of intermediaries? I mean, I think Elias, you kind of got onto that a little bit, that there's going to be these health coaches and people in between. Where do they come from, and how do you scale that kind of side of things?
If you're asking me, I mean, my dream would be to get universities start thinking about this now and start realizing we should actually create a whole new class. I mean, if I could, have that level of impact, which I don't.
Mhm.
But I think we should start thinking about that, because I've actually been trying to do this just in my own work. And I went first, I went and looked at people already in the medical system, and they just literally are so overwhelmed right now. It's not
Mhm.
even an option. I mean, doctors can't even look at the data that is already coming their way, and their teams can't, it's just too much data to ingest, because and to add something in is just a problem. So I'm like, well, where else do we have people in the health space that can help? And kind of right now, the next level you go to, the people that the general public has the most health conversations with, maybe like their nutritionist or their fitness trainer at the gym.
Hmm.
And those people are very motivated to improve health, and really do want to get good outcome for their clients. Like they really, care about what they're doing, but they would need a significant amount of upskilling to understand certain things around, bioscience and, even biopharma, biotherapeutics. And there's like a lot of education that would have to happen there. So right now, I think the challenge we have is there really isn't anything in between. We either have the medical system, and then we have maybe fitness and health coaches that is a pretty unlicensed, uncertified area, or kind of, or there's like a basic level of certification, but there's a lot of knowledge that's lacking. And we really have nothing in between. And I think that's our biggest problem right now, if you were to ask me. And we should be looking very aggressively, I think, to be addressing that, potentially at the, academic and governmental levels. How do we create a new, because people are, we always say we're looking to upskill workers. Well, here's an opportunity.
Mhm.
Well, I know on the federal side, probably 5 years ago, they had a number of large procurements to do genomic counseling, where they were looking for folks to complement the precision medicine working group to be able to deliver genomic information. They led a couple large contracts around that. I'm not sure where that stuff stands now. But also in the news, you've got 23andMe's acquisition of Lemonade. So you've got 23andMe, a hardcore genomics company, acquiring another company that's actually more about the telemedicine virtual interactions. So even the industry realizes that's the proper direction.
Yeah, for me, it's funny. I actually think the model already exists in a way. So you call a call center. Let's say, for example, I don't know if you all have ever interacted with Zappos, limited to no questions that they'll ask you. They'll return it for you. They don't even think twice about it. Just even who you are as a person calling, right? Or just sort of interacting with them, I should say, right? It could be through chat as well, as opposed to a utility company, your internet. Now, I know my internet's probably going to turn off after I say this. So if that happens, don't worry about it. I'll dial back in. But even that, right? How painful it can be. Every time I call, it's a brand new conversation, and they don't pick up on the details that sort of existed before. So I think a lot of the sort of models and the kernels of what could be already exist. Now it's a matter of stringing it together. I think once you move into health, you move into such a personal space, let alone once you start giving up your genetics for things, people are like, wait, hold on, you've got my data, you've got my genes, doesn't get any more personal than that. So just in terms of scaling, I think the model's there, but in terms of the execution, I think that's where the question really is. The opportunity.
If I could just add to that, just because from what I heard, both from what Carlos and Arthur added to my statement, I mean, it sounds to me like it's going to come more from industry itself, right? Rather than anywhere else right now. And so, I mean, that's okay, but it'd be great if we could get other people, having this conversation with us right now, rather than industry needing to build it on its own.
We've begun to touch on this kind of a little bit, but the next set of questions is about privacy. And I think, with all these new kind of players and intermediaries kind of having access to this data, and obviously everybody thinks about Amazon's entry into healthcare and some of these bigger tech companies that are not just connecting health data, but other data as well. Who should have access to this kind of data, and how should it be kind of managed? So just thoughts. I'm sure I know you guys all have a lot of thoughts on this. So maybe I'll hand it over to Arthur. Do you want to start?
Yeah, I was actually on the CMS Federal Advisory Committee for Consumer Engagement probably 10 years ago, when we actually laid down the piping for who owns that health data. That was the first step, was ownership. Who owns it? And that was pretty easily decided that the patient owns it. The next step is derivative data. So a major pharmaceutical company takes your data, create some derivative products off it, who owns that? That's the next issue to deal with. But from a privacy perspective, my experience has been convenience trumps privacy from the consumer perspective. If you look on any of the social media platforms, there's so much health data that people self-publish that it's an interesting quandary of it's much more onerous for a healthcare organization to manage the privacy piece than the consumer side. So a lot of it depends on where you come in from what I call that disintermediation curve, whether it's the clinician side or the consumer side. We provided when we did some VA projects, I was on the hit list for the VA for a while because we would go to veterans, we'd get their permission to log into the VA portal on their behalf and get their data. The VA was apoplectic about that. They were like, you can't do that. Well, it's the consumer's data. So that's one aspect of privacy. Another interesting aspect is for the disabled community. When they convenience for them means if I'm blind, I can have a system that captures everybody's face around me and gives me the data to navigate through that space. Well, I'm violating other people's privacy, but me as the individual who's blind, I need that to function. So those are just some of the other considerations when you start talking about privacy to consider.
Yeah, and to me, I mean, privacy matters. I think where we can't talk about we can't talk about privacy without transparency, and I think that's the key, right? So at one moment it's to say, hey, we're not going to sell your data, but you get into a situation where then all of a sudden tomorrow, hey, we decided, we wanted to send you a beautiful piece of artwork of your genetics. And then tomorrow we decide we're now going to start making compounds to treat certain things because now we have this database, right? That's a hypothetical situation. Just kidding. That's 23andMe. So you think about,
that's what I was about to
people
say.
know.
I was about to be like, yeah, that's exactly what happened.
I didn't want to throw them under the bus, but however, but I think the key though is, so a couple of things, right? For the business themselves, they got to stay viable, right? So I get, how do you sort of create new value and kind of create new sort of products and services or sort of offerings, right? And I think it's okay to continue to evolve and learn new things, right? And innovate. I think that's great. However, how do you stay in touch, right? How do you, whose responsibility is that? And I think that's that transparency part, right? So if literally somebody said, we may potentially do this in the future, I don't know, do people ever read the privacy statements, right? So I think there's just this thing in general where you accept it, you get it out of the way to get started. So Arthur, I'm totally with you. It's the convenience factor right now that's sort of tipping the scales. I think where it's changing though is the person won't be the product anymore. And I just don't know where that's going to go. And that's sort of like the future there. I don't know.
Yeah, I guess for me, this is where the whole thing, coming back to that comment, Mary, about like sci-fi, this is where we go either dystopian or utopian futures, right? Is like potentially on the privacy issue, because, we unfortunately, like you said, Carlos, with the current system we have of the internet, you are the product, right? Like you are what's being bought and sold. And so do we really want to move into an environment where that's being used, our health data is being used in the exact same way? And I personally, that scares me, I'll be honest. Like that is my biggest concern with what I see happening. And there are some companies that are better and worse actors in this space as well. Like I remember I was a little shocked when the Amazon wearable came out, because, Amazon doesn't exactly have the best history of protecting users' privacy, and the wearable literally has 3 microphones on it and is recording every single thing you say every second of every day. And for people who don't know this, just to give you an example of how this could actually be used in a dangerous way, if you will, is that your voice, your vocal inflections are the best predictor of your psychological and emotional state. So we could actually be, if you were listening to people 24/7, which we do now, even if they don't have to have the wearable, a lot of people have smart speakers around their house. Those speakers can essentially monitor and know, based upon your conversations, they know if you're having a fight with your spouse or your children, what's your psychological state, When are you primed to make a purchase and send a push notification through an app, because we know psychologically you're in the best state to make a purchase right now, and send you a pitch, a sales pitch, because we have that data based on your vocal inflection. I mean, this is not a dystopian thing. This is actually something that's possible right now, could even be happening. I have no proof one way or the other. But this is the level of detail that people aren't thinking about when they talk about privacy. And so, and even that Amazon wearable, just to add, I'm sorry, you can throw 23andMe under the bus. I'll keep going. The Amazon wearable is part of what it did. It asked you to take pictures of yourself in your underwear to do body composition analysis. And so do you really want to be uploading pictures of you in your underwear onto the Amazon cloud so that they can do body composition analysis? I mean, it's up to you. If you're, like to Arthur's point, if you find that convenient in a service you're willing to submit to, then it's there. But what's going to happen down the line? And this is what a lot of people are talking about. That data around people's genomic health, right? All of a sudden, oh, you're at an 80% risk of developing a genetic disease before you're 40. Does your insurance rate go up now? What do you do? How do we deal with these things? These are some very real questions. And this is not happening 10 years from now. This is available right now. And, I want to know, my question is like, where's the ethical committee that's doing the analysis of the cost benefit of all of this and reporting back to the government and to the consumers and to the general public about what's happening? Privacy to me is a big question here.
Yeah.
There's a interesting book that I've just started reading, The Age of AI, by the CEO of Google and Henry Kissinger, and there's somebody else who's in it. And they talk about how artificial intelligence is going to cause us to reimagine the entire human experience. And they talk about the going back and looking at philosophy, some of the things that Carlos had mentioned, and just the values of it is defining what it is to be human is going to change. And as we've all alluded to, this, the wearable space and the capturing ambient data is the first step of all that. So it's interesting questions.
I wanted to pick up a kind of related topic. I think, we've been talking about privacy and the data and people using it. I wonder if, are there some, monetization models? All these businesses are driven by, ultimately trying to make kind of money. Are there some more ethical monetization models, or things that seem to be more aligned with the general good, and some that are less ethical? Or how do you think companies should be thinking about monetization? Are there any boundaries, or maybe places they shouldn't go?
Yeah. Get it. Okay.
Go ahead, Carlos.
Listen, this drives me nuts. So the advertising model drives me nuts. I feel like that just needs to change. I mean, right? Like if you're just serving things to just get $1, I don't know. Eventually people realize I just have way too many things, right? What I do think might be interesting though, or rather what I'm seeing are some of these companies that are now doing like B Corps, or at least how they're setting themselves up, right? So they have some good, right? There's some focus to them that they're trying to do. So that's interesting just as far as like living that, right? So like, here's the kernel of who we are. This is our DNA. Here's what we do and how we do it. I think the question becomes trust. Do people trust that? Yes or no? At the end of the day, they still need to make money, still need to keep the lights on. People are working there and everything else. But that's the latest that I've been sort of like noodling on and seeing this new sort of model come up. But
I want to just pick up on this as well. I know Arthur can probably add to this point, so I'll maybe jump in here. And there's a couple companies I know that are working on this idea of coming back to Arthur's point. At the end, the patient should be the owner of the data when it comes to health data, right? So ultimately, unless you ultimately decide to opt out with a private enterprise and give them your data. And for example, like genomics, I saw 23andMe, and I'm one of probably the few people that actually read through some of that when they were the early genomic testing. And I did not purchase that product because I was like, I do not want my data to be sold. And so a lot of people said, oh, you should go get it done. I said, well, I'm waiting till somebody comes out. And now there are providers that their whole ethos, to your point, Carlos, is we will never sell you genomic data. And that is like an ironclad document that you get from them. in exchange for doing your genetics. And there are companies doing that. And then the next phase that I think is going to be very exciting, and I hope this starts to happen because I know a number of companies moving into this space, is the idea of using blockchain technology to secure the individual patient data. And then if you want to sell that data as the patient, I get to collect a fee for you to access my data. And so I can opt in or opt out. And I literally would have a blockchain holding my data in somewhere in the cloud, and I can decide how it's used, and I can commodify my own data if I so decide. That would be the ideal scenario, I think, because the one thing I do want to state here as a scientist is we want access to people's data because we can improve human health if we have more data. So there's a real, coming back to what Carlos said earlier, there's a tension here. We want to protect consumer data, but if we can take anonymous data and get it at scale, we can improve human health. So we kind of need to figure out how to do both at the same time.
Yeah.
And this is screaming for that multidisciplinary approach. NVIDIA is doing a lot of work in what they call homomorphic, NVIDIA and Microsoft are doing a lot of work in homomorphic encryption, which is where they can take data, health data specifically, encrypt it, and still run machine learning and convolutional neural networks against it because the relationships are still there. And they're making tremendous inflows off of encrypted data. Get back to the reimbursement piece, the problem with our healthcare system and where we are now is it has all been fee for service. It's reimbursement based. You start to see certain companies now moving towards a whole health approach. And that whole health is going to also include, the whole being. You've got some stuff. Glenn, I think it's Toolman and his company out of the Matter Health Incubator out of Chicago, and he funds that. Their company. I can't remember the name of their firm now, but that's how they made their great strides, was really focusing on that whole health approach. Carlos talked about it with some of the customer service reps. Call me as much as you want. Well, he does the same thing in healthcare. So as we move to that model and we come up with ways to monetize the relationship, and health becomes another parameter of monetization of nutrition and travel and other things, that's when we get a more altruistic monetization than just advertising. So it'll be interesting to see how that stuff develops over time.
Great. I just want to hit one last topic before we go to questions from the audience, and it's kind of the other side of money. So the investment side. So I think as a lot of investment is coming from the VC community. There's also government investment. What are the different models of investment, and which ones seem to be the ones that are more successful or driving towards better outcomes ultimately? Maybe I'll go to Elias first, because I know you were talking a lot about where the VC community is putting money and some of the pros and cons of that.
Yeah, there definitely are some pros and cons, because I think the challenge we have right now is sort of the way VC looks at capital, or at least a lot of the common investment ethos is the idea, okay, get in, right? Get your month over month recurring revenue to a certain level, scale the business, either once the business gets big enough, either go public or you exit, right? And you get and especially in healthcare, there are a lot of exits, like high value exits that can happen, because there's some very big companies, very big players in the space that if your company gets big enough doing something that they currently aren't doing, it's kind of like the new .com boom, where a lot of like old, large established companies, you would start a .com, you would show that you could digify what they were doing, through traditional means, and then they would buy you. And we're seeing that happen now in the healthcare space, which, again, I'm not knocking that model, but the challenge there is a lot of where this a lot of where this whole thing needs to go, if you listen to the through line of our whole conversation, it's about like ecosystems, it's about multidisciplinary approaches, it's around building deep interrelationships, and all of those things take a lot of resources and a lot of time. So you can't look at like what's the 36-month pathway for us to exit and invest in and then get out and get our money back or whatever. You got to look at longer time cycles. So that's one of the challenges I think that's happening within the current model. And a lot of money went into healthcare because of COVID. So there's a lot of capital right now looking for a home. And so one of the projects I'm doing here in Los Angeles, where I'm based out of, there's a group called Bioscience LA, which was a great, is trying to build like a hub ecosystem to connect, academic partnerships, the business community, the investment community, even the real estate community, so we can build space. How can we do more training and development? How can we bring investors? How can the government support it? And I think that's kind of the new model we need to look for going forward. And Arthur already touched on this, is the idea that there needs to be a very multidisciplinary approach where a lot of siloed institutions, agencies, investors, like things have to start becoming a little more connected if we're really going to build the ecosystem that's needed here. And so looking at the traditional models of investment, may be lacking, I think, to achieve our goals here. If we want to look at the big goals, if we want to look at, could you solve one, could you find a digital therapeutic for a specific condition, treat that audience, give it to them, get a lot of money and get out? You could do that, but that's not really going to benefit society as a whole in the way that we need to right now.
Yeah, I agree 100%. I think that for the past 25 years, the healthcare VC community has been all about increase top line revenue and sell it to the next guy up chain. And that next guy buys market share and deals with it that way. I've been involved in a couple funds recently and severed relationships because it was all about just churn the money. And I'm starting to see a few venture studios come out, and we're involved in starting one where it's really about how can we find specific synergies between the portfolio companies and the target markets that these portfolio companies are developing technology for. If you look at what's going on with WeChat and Tencent in China, that's exactly what their model is. Be be the single source for the consumer around not only healthcare, but everything else. And so the good news is there are some companies moving into that space, but there's still so much money to be made the old way that it'll be a while before everybody needs to see the light.
And I'll be honest with you. I mean, I think Arthur and Elias are just much smarter than I am in the investment. I can tell you though, what I hope to see. I hope to see sort of a Kickstarter model around healthcare. So for instance, I don't know if y'all saw, there was an article a couple of days ago in San Marcos, Texas, I think it was, but basically they discovered this intestinal parasite that burrows through your foot. So imagine if there's just a problem that's happening locally. Why would a larger company want to invest in these types of things? So I really do think that there's this interesting sort of localized investment, and it may not be coming necessarily of money. I think it's people, time, voice, like level of voice. Like there's just these other parameters I think that'll start coming into play where it may not be a dollar one-to-one, right? That's what I hope to see.
I think one of the things that I've kind of observed in working with different companies in the healthcare space is ultimately most people are motivated by creating better outcomes for patients ultimately, but sometimes the incentives just kind of get in the way. So sort of trying to align these things with what everybody wants, I think is
misaligned incentives and transparency.
Yeah. Great. Mary, any interesting questions?
One thing that we can loop back on, I know we touched on this like a little bit, but wondering if I'm Dr. Warren, where do I fit into all of this? Where do the physicians fit in? What are some of the biggest challenges to getting them on board and integrating them into these services and systems? I'll kick it to Carlos first.
Wow, that's a big one. I would say this very well. It depends, right? Because then I think if I start thinking about specialties, there's sort of certain behaviors that come along with certain specialties. But
Interesting.
yeah, I would say this. I still think so. It would actually come back to responsibility, right? So like technically, who would be responsible for whatever the outcome is? So for instance, if someone's doing a diagnostic early up front, you get this diagnosis, and then the doctor, the HCP says, okay, it's going to be X. If they're responsible for that, I would assume they're still a part of that process and that conversation. I do feel like no matter what, it should fall back onto a person, right? Because then, for example, like I think there's the conversation around, okay, if you're using, for example, you're driving your Tesla and it crashes, you're on autopilot, who's responsible for that? Is it the car company? Is it the software, right? So like level of responsibility. Where do they fit in? I still think they have a huge place in this. I don't feel like, though, in the current model or system where many these much larger systems that are being bought out, where you spend about an average of 15 to 20 minutes, not sure that that's the solution. So even something needs to change there. All that being said, I think their voice, their opinion matters in it, but I feel like it's more of a backstop than the catalyst, right? I feel like there's so many other things that could basically be done before an HCP will get involved.
Yep. Elias, do you want to touch on this? I know we got to chat about this a bit.
Yeah, I think, I mean, actually, there's so much here that, you know, where the physicians fit into this sounds like such an obvious question, but as Carlos alluded to, there's so many different layers of how that works. And it's quite a complicated problem, because right now, physicians at the end are a little too overwhelmed with data. And as Carlos said, you know, they have 15 minutes with a patient, and there's a lot of people complaining, coming back to the empathy conversation, of the 15, 20 minutes. There's been some studies done of the 15, 20 minutes that they have with the patient, less than 2 to 3 minutes is with direct eye contact, because they're staring at a computer the entire time, inputting data. So of that 15 to 20 minutes, there is no human contact, human eye contact within that time. So, you know, how do we fix that? I think is something to think about. If how does technology now empower physicians? And what I'm seeing actually is a lot of physicians moving into concierge medicine because they want to be able to spend an hour with their patient, talking to them, trying to understand their story. But on the technology side, there's some cool things as well, because there is one company that has the doctor looking at you the entire session, because they have a AI assistant voice transcription in the room, recording everything that's said and then transcribing it. And the transcription software even has intelligence where it actually recognizes when the doctor is saying specific things or when you disclose a specific type of condition. And I went to one of these clinics to check it out myself. And yeah, the doctor just looks at you and you have a conversation the whole time. So I think what we need doctors to kind of maybe advocate a little bit about what they need to see happen so that they can practice better. I think that might be one of the useful things. Like, how can we make doctors better physicians and better healthcare providers? Because I think they have a lot of things right now that make that difficult for them, and they know best of what's their barriers to success. And I'm not sure they're being asked properly, to be quite honest.
Yeah.
Well, I'll start off with those guys. You guys were both very nice about that. I think I'll be the bad guy. I say just because you know medicine doesn't mean you know anything about healthcare. And so many healthcare systems have stood up an innovation or engagement office and they said, oh, we'll take this doctor and we'll put him in charge of it. And that has caused more problems than solved more problems. I think Carlos also hit on a piece that is another one of the old components of the old healthcare system. Who do you sue? Our healthcare company, our healthcare ecosystem is built on who do you sue? I can't sue an algorithm. I can only sue a doctor. So doctors are going to have a spot in this because that's a machine cannot practice medicine by law. Only a physician can practice medicine. I also say you can find 500 doctors to buy anything, but finding 5,000 to buy something, or that actually starts to affect behavior and change and things like that. So one of the primary measuring sticks, one of the primary continuums that you've got to decide where you sit on, I mentioned that disintermediation scale. Are you going to include the doctor totally and use it as a distribution mechanism, or are you going to go direct to consumer? Pfizer proved without a doubt, if I put a commercial on TV for Viagra, I can affect physician behavior and consumer behavior. Instead of going to the doc, they went right to the consumer. So that's not I don't think that's the appropriate mechanism for all things, but as you're designing solutions, developing technology, you got to kind of figure out where you're going to fit on that continuum.
And so I'll wrap with one bigger picture question that we have. So you're all working on really big projects and initiatives to make diagnostics more accessible and better for the future. So if things went well, and well is a pretty subjective qualifier, so I think each of you will have an interesting take on it, for the next decade, so next 10 years or so, what differences would we see compared to today? Carlos, do you want to start?
I mean, to me, it just comes back to the word care. I think people will care about their health. I think, for instance, many are just sort of like running ragged, so to speak, right? So much to do, I just get more work, blah, blah, blah. I think there's that aspect of it, which is probably the biggest aspect. Somebody actually cares. Someone's helping me with all of my health. I do think, though, a lot of these things do need to fade away. So the technologies, all these other things, like they sound great, but I don't think I don't think people care what's behind it as long as they're getting the right care. Right. So I think that matters. I think it's the individual first. I think the individual sort of needs to be propped up. And they basically need their own. I know we were talking about like ecosystems, but they need their own support system. What is that support system? That sort of, like if you're playing a sport, you've got your coaches, you've got your other teammates. What is your treatment team that's coming with you? And that to me is sort of the future of it. So I think it's more people. The perception or the visual is that there's more people involved. Everything else, the technology, all that other stuff is going to fade into the background. That's sort of how I see it if we're successful, because then it means that I can reach somebody, and that's okay if a piece of technology is assisting them, that's fine, but it's just not in the forefront. So that's where I see it going if we've done this correctly, if we've done this well, and everybody is well, and they're taken care of. It's my view. Yeah,
it's really interesting. It's also good to hear that we're going to come back to the people and that technology isn't always the forefront of the future.
Bedside manner is going to matter. I do think bedside manner is going to come back, I'll get off my soapbox on that. Sorry.
Yeah. Elias, what are your thoughts?
I mean, I'm a bit of a data person, right? So I like to measure data. And so I would say if we were to measure healthcare as a system and look at the last 30 to 40 years, according to the CDC figures, we have 6 out of 10 Americans have one chronic disease and 4 out of 10 have 2 or more. So that has only happened to that degree in the last 30 to 40 years. So essentially that's an F, right? Our healthcare system gets an F right now. Right? We failed. Yeah. And we need to start to own up to that. And so, I would say if we were to succeed, then we would bring this back down, right? We shouldn't have 60% of the population living with a chronic disease when over 80% of those chronic diseases are preventable. That's horrible. That's a complete disaster. And so that's, I'll play the bad guy to I'll team up with Arthur and be saying like the healthcare system has failed, and the physicians and the whole industry probably hasn't done what it should be doing, which is preventing disease rather than waiting until you're sick and then giving you some type of treatment. So what would the future look like? The future would look like prevention. We would get these numbers down and get people into a healthier state. Even if we don't extend health span, because I'm big into cellular medicine and I'm getting older, so I want to stay healthy as long as I can. So I think we could extend health span, but at the very least, we should be reducing chronic disease and reducing preventable conditions. And if we don't do that and we continue to fail, I mean, things are going to get pretty bad, because now we're spending so much money on managing these people with chronic conditions. It actually would be less expensive to go upstream and prevent them. And we're still not talking about that, nowhere near the level we have to. So there's my soapbox rant for the to end off the talk.
And Arthur, your turn.
Well, I would say that listening to these guys, I've learned a lot and thinking about a couple different ways now. I think the future state of healthcare is going to be very distributed, very personalized, and tech enabled. So but we also need to address mental health. As we talk, probably the thing that has led to many of the as the economy has gotten better and the nation gets better, there's certain diseases that come along with that. You know, I think about people who say, you know what, instead of not eating meat, let's make a plant-based thing that looks like meat. You know, no, we should just not eat that. So there's a mental health, component that we need to address. We need to educate consumers as well as physicians on some of the mental processes which lead us to behavior which is going to hurt us. Look at the vaping industry. Look at smoking cigarettes. You know, we all know it's bad, but we still do it. So the one thing I'd like to see as we in the future state of healthcare is a much better impact of mental wellness, and really considering mental wellness as part of a critical component of the healthcare system.
Yeah.
Great. Those are all fantastic points to end. It has been great getting to know each of you individually. You guys have such amazing expertise about this topic, and it's been awesome to see all those combined intellects adding up to something greater than each of you. So it's been a fantastic discussion. I think we've all learned some things and discussed some new aspects of this topic. So thank you so much. I just wanted to quickly just talk about the next Salon, which will be coming up. Hopefully everyone can see it. Will be coming up on December the 14th. The title of it is Bridging the Knowledge Gap in Women's Health. We have a couple of awesome panelists lined up. We have Alyssa Meza, who is one of our clients from Upstream. If you're interested in that work, you can check out Upstream's website or the link on our website. And we also have Maria Lally from Cheek, which is going to be an amazing panel. We have a third panelist as well. And if you are interested in the topic, you can RSVP on our website on the link below. So thank you, everybody. Thank you, panelists. Thank you, Mary, for co-hosting with me. And we'll look forward to seeing everybody in the next event next month. Thank you so much. Have a great evening.
Thank you so much.
Thank you.
Thank you, Richard, Mary. Thank you all.